We went and we saw Anna Strahan, and she told us that she thought it was scoliosis just at first, because that's what they noticed. And then so we asked about the hunching. She was like, that's different. So we took some more sets of scans, and like we realized that it was pretty bad, and I needed something to, like, we needed to do something. I want to be a doctor, especially a surgeon. I've been wanting to be that since I was about like 5 years old. I guess the fact of helping people and just trying to like learn new things.
I had picked up on the fact that her back, it looked hunched when she was working on a laptop or playing a game, but it seemed to either be getting worse or we just seemed to be more plugged into it.
I had taken her to Dr. Calix, and who sent us to the orthopedic department. It was in the process of that meeting with Anna Strahan that she did an extra test and realized that it was a bit more serious, a lot more serious than what they had anticipated.
So EOS imaging is actually an x-ray machine that takes much better x-rays of the children and actually allows us to get 3D imaging for much lower radiation than the typical x-rays that people get. We looked at her x-rays and we saw how big her curve was and how big it had gotten, and we decided that she would benefit from a posterior spinal fusion, which is a surgery where we put in screws and rods and straighten and stabilize the spine.
They took me to the operating room, which usually I would have had my glasses off, but I really wanted to see the operating room and I really wanted to experience that and what that would be like. So they let me keep my glasses on and they let me look around and see everything.
You know, it went from, I can't believe that this is happening to my daughter, to, okay, we've got a good team, we know what to do.
So in Sophia's case, her pediatrician, Dr. Calix, called me, and we were able to discuss her case and get her in for care, and then we continue that continuity throughout the process. So our pediatric anesthesiologist, our pediatric ICU doctors, our doctors that help us take care of patients on the floor are all involved in that process, and we all share the same medical records. So we all see everything that's happening as we go through the process.
She wouldn't look at herself for a little while after the surgery. The first time she ever really said, okay, I'm gonna look, and her face lit up. And she says, Mommy, look how straight my back is. And it just, she was in amazement over herself and couldn't stop looking at her back. And that was a wonderful moment.
I don't think anything could stop me from wanting to be a doctor. It made me understand like what exactly doctors do and what I would be able to like help people in a way that like makes them not only physically feel better, but emotionally it makes them happier. It felt like great that I could be and do anything that I wanted to.